Hi guys, I'm Dr. Bobby STRYKER. I'm one of the founders of RESCU. We've been getting a lot of calls about whether we see children or not, and we definitely do. But before we get into that, I'd like to give you some background about myself, what kind of doctor I am, what training I've had. So I've been a doctor for 15 years now. I'm from the UK and I'm an MRC GP holder, which means I'm specialized in family medicine. And what that means is that I've actually done a lot of different specialties in my training. So I've gone through pediatrics and neonatology, taking care of very young babies. I've done obstetrics and gynecology, psychiatry, elderly medicine, a lot of accident emergency, over about a year's worth, and probably, you name it, I've probably done a bit of it. And then I moved to Singapore in 2010 and I was in the polyclinics for the last 8 years, and now we've gone really into full-on family medicine, bring all of this experience right to your homes to help you take care of your loved ones and definitely your children. Okay, so we get called a lot about kids with fever, especially if it's in the evenings and maybe the GP clinics are closed and you might not feel it's so serious that it warrants a visit to A&E, and rightfully it might not do. So when should you call us, or when should you pop down to KK or NUH Children's A&E? Well, good rule of thumb is check your child's activity and feeding level. If your child is active and alert and they're feeding okay and they're passing urine well, then that's great. If they're not passing urine, that means that they don't have any water inside, so that's possibly a sign of early dehydration, and that's quite concerning. So any child who isn't feeding well and they're not passing urine well and they're getting drowsy, then actually, yeah, you might want to pop them over to KK or NUH Children's A&E. If they're still feeding well, active and alert, and passing urine well, so that means they're well hydrated, but they've got a fever and you want to get it checked out, maybe they've got cough, flu and other symptoms, then by all means give us a call. We'll be more than happy to help. Okay, now you also need to be careful if your child is very young. So if there's a child who's less than 3 months old and they're having a fever, that's actually quite worrying. And what KK and NUH and the specialists and the hospitals recommend is that any child who is less than 3 months old having a fever, they should go to A&E to have a proper checkup to find out where that fever is coming from. Remember, fever is due to the body's reaction to infection, germs like viruses and bacteria. So as your body fights those germs, you will mount this kind of fever response. But when a baby is so young, it can be quite concerning. Maybe it's a really serious infection. Why are they getting a fever so young? So if they're less than 3 months old, pop over to the A&E, see the KK or NUH Children's A&E, and they will take care of your baby. So if your child has a fever with obvious signs of infection, so fever, runny nose, fever, cough, fever, diarrhea, fever, vomiting, fever, earache, we can definitely help with those. And we've got on show some of the things that we will bring to your house. We've got children's Panadol. These are suitable for infants less than a year old. We have older children's Panadol. We have Brufen when the fever is getting a bit too high. We have cough syrup for children, tummy pain medicines, antibiotics suitable for children, diarrhea medicines, flu medicines, and even vomiting medicines. So the full shebang. So if you have any concerns, you're still not sure, just give us a call and we'll be more than happy to talk to you and run you through some basics. Okay, so that's it guys. I hope that answers some of your questions about fever and infection and children, and when you can call us or when you should be paying a visit to your local hospital. If there's any doubt, do not hesitate, pick up the phone and call us 877-99441. We're happy to answer any questions you might have. So take care and see you next time. Bye.